Hello, everyone. My name is Dr. Thomas Sims. I'm a dentist here in Scottsdale, Arizona. I've been practicing dentistry for many years here. A little bit of my background: I went to Arizona State University and then later attended Loma Linda University in Southern California. I also have became a center, what we would call the TMJ and sleep therapy centers. There are some, I believe, almost 65 centers now throughout the world. There are two here in Phoenix. And we follow particular protocols or particular principles of evaluating and treating patients. We as dentists were trained to have an understanding of the head and neck area, not just the teeth, but also what's behind the teeth, such as TMJ and the airway and all things. So today I wanted to share a few thoughts about the airway, and that's what I've entitled my presentation. It's all about the nose. Well, at least it's the beginning of it. And so this is the beginning of the airway, is our nose. And unlike what most people think, it's our mouth, but it's really not. The mouth is made to eat with and to speak with, but the nose is what we breathe with. So in getting involved in that in today's presentation, I want to share a few pictures of what it would look like for those that are mouth breathing, and maybe some of the consequences of that. Now, my intent is not to describe exactly those consequences in depth, but just simply to share with you what it might look like you might find with your children, and frankly, some perhaps with your family members. There was a book written several years ago by an anthropologist, Dr. Kahn, and a orthodontist, Dr. Kahn, and an anthropologist, Dr. Eric. And they wrote this book called Jaws. And if you notice, it says the story of a silent epidemic. And what they have found over the research over the last several hundred years, looking back into different skulls and different skeletal developments, they have found that we, especially in North America, have developed into more mouth breathers than we are nose breathers. And so what I would like to do is continue to present, have an understanding of what it means to breathe through the nose, and then show you some of the consequences of that. So here's a picture of the 4 points of obstruction of the nose. You see number 1, 2, 3, and 4. Or number 1 is the nasal valve. That obviously is where the air comes in. And then the turbinates would be where number 2 is located. Tonsilladenoids would be number 3. Of course, the number 4 would be the oropharyngeal area, where we might find a collapse of the airway. In this particular area, number 4, you can actually have a total collapse of the airway where the air does not go any further than that point. And we would refer to that as sleep apnea. But when we start developing problems within our nose where we have obstructions either at one of these 4 areas, what we do is we start to develop what we call mouth breathing. And as I spoke of before, the mouth is not made to breathe with, but we must use it if our nose is not working. So what happens when we breathe through our nose? Well, when we breathe through our nose, the nose or the air is moistened. It's warmed and it's filtered as it comes through the cilia that's inside our nose. Of course, this is our first line of our immune system to fight against pathogens that we breathe in our environment. There's a gas that's created in the nose that's actually created in the maxillary sinuses on both sides. And nitric oxide is injected into the air that we breathe through our nose. And there's a couple purposes of nitric oxide, one of which is that is a antimicrobial property where it kills the pathogens within the air and helps bathe the tonsilladenoids with that gas to reduce inflammation. In addition, also, it actually causes a greater affinity or attraction of the oxygen molecule to the red blood cell once it gets down into the alveolar sacs within the lungs. And they've noted that you can receive anywhere from 14 to 18% more oxygen by breathing through the nose over breathing through the mouth. One thing we find also is our posture becomes more upright as we breathe through our nose. And of course, we have improves the likelihood of having straighter teeth. So what happens if our children don't breathe through their nose?